I've heard a lot of people saying, me, I don't do scaling and polishing. You know, all those things that they use, they're going to damage your teeth. My teeth is going to be chipping off and flying out of my mouth. That's not true. That's a myth. Scaling and polishing is something that we as dentists recommend that you do every 6 months. And scaling and polishing is actually the mechanical removal by a professional, a dentist or a hygienist, taking out the calculus and the plaque out of your teeth. If you look into your mouth, like I always say, you will find these yellowish bands that are very close to the gum line. And no matter how hard you brush, you can't take them out. Those things are called calculus. Sometimes they can be greenish, they can be blackish, depending on how long they've stayed in the mouth of the individual, and they can be very unsightly. Apart from that, they cause gum disease. They irritate the gums and they cause bad breath. So let me show you, so that to allay your fears of what actually happens when you come in to have a professional teeth cleaning done. And please do your scaling and polishing with a professional. You know, scaling and polishing is something that you should do with a professional. Now, when you come in to do scaling and polishing, there are actually two main ways of doing it. The classical way of doing it is using the ultrasonic scaler. This is an ultrasonic scaler, and it has a tip, okay, that we use in taking out the calculus, the bacteria, and the stains out of your mouth. What it simply does is it vibrates and brings out water. So what it does is that when we put it in your mouth, it is vibrating off the calculus from the surface of your teeth. Remember that I said that no matter how well you brush, your brushing can't take out the calculus. So this machine, the ultrasonic scaler, actually vibrates and takes out the calculus and also releases water to clean the surface of the teeth. Okay, so no harm at all. It's not doing any harm to your tooth surface. And then when we are done taking out all the calculus and the debris in your mouth, we do what we call polishing. Okay, now the polishing is we use a brush. Okay, it's just like a very small toothbrush, you know, like you use at home, but this is what we use. And then we put a paste there, which is called a prophylactic paste. And then of course, when you press your pedal, it sounds like a motorcycle, right? Okay, so what it does is simply it rotates, just like using an electric toothbrush, not harmful at all. Okay, and then it just polishes the surface of your teeth, because by the time we use the ultrasonic scaler, we want to smoothen the surface of your teeth so that it doesn't attract, you know, more plaque. You know, I've told you about plaque before, and debris on surface. You know, when you have that scaling and polishing done, you know, some people tell me, oh, I feel rejuvenated. The surface of my teeth feels squeaky clean. You know, you get it? Yes. Okay. So that's simply what scaling and polishing is all about. It's a harmless procedure, okay, and it is necessary. If you have braces, you should do your scaling and polishing more frequently, at least every quarter, because if you're having, especially if you're having brackets and wires, the accumulation of food. Now, there is a more modern way. I don't want to call it the holy grail of doing scaling and polishing. It is called airflow, okay? Now this one, because some people say they don't like the way the ultrasonic scaler vibrates, and they do get a bit of sensitivity after they've done that. But please be rest assured that the sensitivity is very transient. It's not something that will go on forever. You may have a bit of sensitivity for a few days, and after that it stops. But you can also try a new way doing scaling and polishing, and it is called the airflow machine. So how does this work? This one, we're not vibrating anything. It's not giving you that zzzz sound like somebody said, it's doing zzzz and I'll be hearing it in my brain. No, this one is a more seamless way of cleaning your teeth. Okay, how does it work? So you can see here it has a powder, and of course it uses warm water. So what we simply do is that we put you on our chair and we use the airflow that releases water and powder. So it comes out with a lot of force, and that force with the powder mixed with the water, you know, comes on the surface of your teeth and slowly removes the calculus, the stains, and it even gives a deeper cleaning, because sometimes it can go below the gums and give you that really nice cleaning. And of course, there's no sensitivity. So if you usually have sensitive teeth after you've done your scaling and polishing using the ultrasonic scaler, you can ask your dentist to do the airflow cleaning for you. It's a more deeper cleaning, okay? And no sensitivity at the end of the day. So what's your excuse? You know, there's no excuse anymore. Oh, doc, my teeth is shocking. No. Airflow. Doc, my teeth will break. No. Ultrasonic scaler. So I have debunked every myth that says that scaling and polishing is damaging your gums, is damaging your teeth. You know, don't go and do it, your teeth will crack. No, those things are lies. The scaling and polishing done professionally by a dentist or a hygienist will benefit you a whole lot. So pick a pick. Ultrasonic scaler or airflow. Don't say I didn't do anything for you. The dentist is your friend. I remain yours truly, Dr. Joan Agbanikana. If you like this video, I know somebody who's running away from doing scaling and polishing, please send them this video, share this video, like this video. You will do them a whole lot of good.